Hello friends, very warm welcome. Today I'm going to talk about is there any criteria for admitting a patient of bronchiolitis in the hospital. This is very important topic for board examination, pediatric board examination, and for Usmle examination and for MRCPCH examination. So because most of the cases of bronchiolitis are managed in home, because the babies suffering from bronchiolitis do very well in the home. So is there any criteria for admitting these patients in the hospital? That's what we are going to talk about. Okay, before starting this, I will request you to subscribe to our channel and tell your friends about our channel through Facebook, email or Twitter account, and please subscribe. Okay, let me start with this. Briefly I will discuss about this. Okay, one of the most important criteria you should admit the patient of a bronchiolitis to the hospital is a cyanosis. Look at the signs of the cyanosis. If the patient is cyanotic, okay, there's a blue discoloration of the lips, hands, is a breathless, okay, so difficulty breathing, then admit the baby to the hospital. Because we know that bronchiolitis we can manage at home, we usually see the patient, we don't prescribe the medications, like just salbutamol will be okay, but it doesn't work. Steroids, no help. So they can do very well if you give the time to them, so they recover very well. But sometimes we need to give this, we need to admit them, and one of the criteria for the admitting to the hospital is cyanosis. Okay, next criteria, ask the mama that whether the baby is taking less than half of the what she was taking before. Like for example, if she is taking good enough and the mom says okay, the intake has decreased to the half, 50%, then you need to admit the baby to the hospital. This is the second criteria. And the third criteria, most of us know, that's the respiratory distress in the form of grunting. Okay, so is there any look for any respiratory distress in the baby? If there's any signs of respiratory distress, then admit the patient to the hospital. Apneic episodes, very important. If you observe any apneic episodes in the baby, usually you can see in the baby's apneic episodes, then you need to admit the patients to the hospital. Oh, okay, the other criteria is if the baby is having congenital heart diseases, because if they have the congenital heart disease, definitely it will prolong the course of bronchiolitis and can complicate it. That's why you should admit these babies to the hospital. And the premature, if the baby is a premature, then you need to admit them to the hospital. Okay, and the other criteria is there any other factor, like a social factor, then you can admit the babies of bronchiolitis to the hospital. Okay, these are the criteria. Just revise once again fast. Cyanosis, food intake less than half, respiratory distress in the form of nasal grunting, apneic episodes, congenital heart diseases, prematurity, okay, and any other social factors. Thank you so much for watching my video. Take care.